All right, Dr. R focusing on some epi questions. So again, the lead in, can we answer this? What is the objective of the health? Nope, we can't. So we need to look at the case vignette. For me, I always go back to here. So annotation, comparison, description, and grounded in theory. These are different methods that we would use for the analysis of what we're actually trying to do in the research. So I'm going to be looking for what kind of research study is happening up here, and then what are the outcomes? Am I going to want to compare or describe or ground it in theory or make some kind of annotation? So let's go back to the STEM. A group of research wants to investigate the effectiveness of a new drug. So effectiveness, we got a new drug, and it's for hypertension. Looks like we're recruiting 500 participants. Ooh, do we get a randomized controlled trial here? Oh, and we are randomly assigning them. So we are looking probably at an RCT. There are other studies that do randomization, but let's keep on looking on. Randomly assign them to one of two groups. Well, one's going to be a treatment group. They will get the drug. And the other's a control, right? So we talked about this before. We got the experimental group and then the control group. And so one gets the drug and one gets no drug. Sorry, I can't spell today. They get the drug, actually they get a placebo. So they get no drug, which equals placebo. The researchers measure the participants' blood pressure at the beginning and end of the study. So we've talked about this on a different question, right? So they measure BP at the beginning, and then they measure BP at the end. And so that's capturing baseline data. So now we're looking like one of the other ones we discussed. And this is very much looking like something like an RCT. At the end of the study, and then we compare the results. So that's an interesting word. We compare the results between the two groups. So drug, placebo. So annotate. The objective of annotation is not really relevant here because we're really just going to kind of describe what is happening. So that one I think is a no-brainer we can get rid of. But remember before we had another question that looked at RCT and comparison was actually a part of the answer choices. But I chose not to use comparison. But I did say that it is likely that we are doing a comparison. It's not completely incorrect. And it does say compare here, but is a randomized controlled trial. We are collecting baseline data, and we're comparing that to the outcome data. So this is very much looking like one of the previous questions that I talked about, but yet I chose not to use comparison. But as you can see here, one of the things that is actually missing is predict, which was what was happening on the other question, remember? So description, are we just describing what's happening here? I don't think so, because we're actually doing some randomization. We have some baseline data, comparing it to outcome data, where we have a placebo. So description is not the best answer. Because I think if I was going to choose anything right now, comparison is more powerful than description, or more correct than description, and comparison is also more correct than annotate. And then grounding in theory. We're not talking about anything here in theory at all. We're actually using patients and a medication and randomizing. So this one is more qualitative and not quantitative. We are in quantum world. This is the world we live in health science research. So this one is not good. So really what it's doing is it's leaving me with comparison, being the correct answer. When before I chose predict. Because in this situation, comparison is the most correct, not the correct. Okay, so in this situation, comparison wins because it is more correct than all of these.